It's Brittany Levy from Stay Current, and we are back with another article that you should know. This time, we're talking about stoma-related morbidity in children, which is discussed in a recent article by Vogel et al. In the Journal of Pediatric Surgery from 2022. As a reminder, stomas or ostomies are basically a surgical fistula created between either the small bowel or large bowel and a patient's abdominal wall. And that's where they pass waste, like stool or succus, into an appliance on the outside of their body. However, the morbidity for stomas in young children isn't well studied. Or at least it wasn't, before Vogel and her team looked into it. So to evaluate this morbidity, the authors looked at 336 children who received a stoma and noted that 27% had a complication like prolapse, high output, or stenosis. In 292 kids, the stoma was reversed, but even still, 23% of them had problems like hernia, adhesive disease, or anastomotic complications. So what exactly are we saying here? Having a stoma leads to significant implications for these kids that range from multiple admissions, malnutrition, and repeat operations. Therefore, when considering primary anastomosis versus stoma creation, a careful risk-benefit ratio really needs to be evaluated. Check out the Stay Current app for more articles that you should know.